Oh, Hilton, stay. Your beds are soft and cozy. No lumpy couch, no stiff futon, no shower line at crack of dawn. Oh, Hilton, stay. A holiday you're saving.
When you want holiday comfort you can count on, it matters where you stay. This season, enjoy spacious, comfortable rooms and friendly service when you book with Hilton instead. Hilton for the stay.
Every who down in Who Newville liked the holidays a ton, but where to get great prices on gifts they had no idea. None. They searched and they searched for great gifts under $25. Gifts for spouses and friends and even their toddlers. When suddenly one who shouted, Walmart has what you want, knowing they have Lego, Tree Hut, and low prices to flaunt. So they enjoy the holiday season as who's often do. Cheering and shouting, Walmart has incredible gifts. Who knew? Find gifts they'll love under $25 at Walmart.
Hi, my name's Alex Conway, and I'm a third-year medical student at Kaiser School of Medicine. Neurology question 7. A 56-year-old woman presents to the emergency department complaining of progressive weakness for the past 3 weeks. Prior to the onset of her symptoms, she was able to ambulate without assistance, and she was fully independent with all of her daily activities. Approximately 3 weeks ago, she noted some weakness in her arms and legs on both sides, which has progressed to a point where she is having trouble walking up the stairs or lifting any heavy objects. She says it has been difficult for her to get up herself from a chair as well. She's also been mostly sitting on her couch or bedbound in the past couple of days. She says she's been taking lisinopril for hypertension and atorvastatin for hyperlipidemia for the past 5 months. On review of systems, she denies fever, recent travel, recent vaccination, sick contacts, chest pain, difficulty breathing, recent trauma or injury, or urinary or bowel incontinence. She denies alcohol or substance use. She works as a gardener. Physical examination shows bilateral weakness in her proximal arms and legs, with 3 out of 5 strength in the affected areas. Her brachial and patellar reflexes are 2+. Distal pulses are 2+. Laboratory findings show elevated creatinine kinase of 2,300 international units per liter. TSH is within normal limits. Considering the most likely diagnosis, which of the following is the most appropriate next step in management? A. Consult neurology. B. Discontinue atorvastatin. C. Obtain anti-acetylcholine receptor antibody. D. Obtain anti-HMG-CoA reductase autoantibody. Or E. Obtain CT of the head. The correct answer is B. Discontinue atorvastatin. This patient's clinical presentation is most consistent with statin-induced myopathy. Complaints such as difficulty walking up the stairs, lifting heavy objects, and standing from a chair are classic presentations of proximal muscle weakness, which is a characteristic finding in patients with statin-induced autoimmune myopathy. There is generally no correlation between the onset of autoimmune activity and how long a patient has been taking a statin. Symptoms may occur soon after the initiation of a statin, or they may also appear years after. The mechanism is due to the development of autoantibodies against HMG-CoA reductase, which can be ordered if suspicion is high. However, the most appropriate next step for treatment is discontinuation of the suspected eliciting agent for the most likely differential. Spontaneous improvements in symptoms should be expected within days to weeks. Creatine kinase should be reassessed in 8 weeks to ensure resolution of muscle damage. Answer choice A, consult neurology, is incorrect. Although evaluation by a specialist is important down the line, the first step would be to stop the suspected eliciting agent. Answer choice C, obtain anti-acetylcholine receptor antibody, is incorrect. Anti-acetylcholine receptor antibody is associated with myasthenia gravis, which presents as muscle weakness after repetitive use. Most patients describe weakness that is worse at the end of the day. Associated symptoms include ptosis, diplopia, dysphagia, and dysarthria, which are absent in this patient. Answer choice D, obtain anti-HMG-CoA reductase autoantibody, is incorrect. As described above, anti-HMG-CoA reductase autoantibody should be obtained if suspicion for statin-induced myopathy is high. However, the most appropriate next step is discontinuation of the eliciting agent prior to further workup. As long as the patient remains on the medication, it could lead to further muscle damage. Answer choice E, obtain CT of the head, is incorrect. The patient's symmetrical proximal muscle weakness is less likely due to an acute stroke process. Suspicion is low. Key learning point. Although statin-induced myopathy is very rare, when a patient presents with proximal muscle weakness or muscle pain while they are taking a statin, check for creatine kinase level. Discontinue statin if the level is elevated. Neurology question 8. A 20-year-old woman presents to the emergency department immediately after falling 10 feet off a ladder. On presentation, she has a Glasgow Coma score of 15 and complains of left-sided head pain. CT scan indicates a left frontoparietal epidural hematoma. She then develops right lower extremity weakness. Her pupils are equally round and reactive to light at this time. Which of the following explains her progression of symptoms? A. Left anterior cerebral artery compression. B. Left middle cerebral artery compression. C. Right anterior cerebral artery compression. D. Right middle cerebral artery compression. Or E. Uncal herniation. The correct answer is A. Left anterior cerebral artery compression. The pressure from this patient's epidural hematoma has likely caused a subfalcine herniation, resulting in compression of the vasculature controlling her right lower extremity. The lower extremities are controlled by the contralateral medial motor cortex, which is fed by the anterior cerebral artery, or ACA. Therefore, this patient's right leg weakness is most likely a result of left ACA compression. Answer choice B, left middle cerebral artery compression, is incorrect. This would manifest as right-sided upper extremity and/or facial weakness. Answer choice C, right anterior cerebral artery compression, is incorrect. This would manifest as left-sided lower extremity weakness. Answer choice D, right middle cerebral artery compression, is incorrect. This would manifest as left-sided upper and/or facial weakness. Answer choice E, uncal herniation, is incorrect. This would injure the patient's cranial nerves and would likely present with an abnormal pupillary reflex. Key learning point. The anterior cerebral artery feeds the part of the motor cortex that controls the contralateral lower extremity, while the middle cerebral artery feeds the part that controls the contralateral upper extremity and face.
When the holidays start to feel a bit repetitive, reach for a Sprite Winter Spiced Cranberry and put your twist on tradition. A bold cranberry and winter spice flavor fusion, Sprite Winter Spiced Cranberry is a refreshing way to shake things up this sipping season. And only for a limited time. Sprite, obey your thirst.
This episode is brought to you by Indeed. You're ready to move your business forward, but first, you need to find the right team. Start your search with Indeed Sponsored Jobs. It can help you reach qualified candidates fast, ensuring your listing is the first one they see. According to Indeed data, sponsored jobs are 90% more likely to report a hire than non-sponsored jobs. See the results for yourself. Get a $75 sponsored job credit at Indeed.com/podcast. Terms and conditions apply.
Neurology question 9. An 88-year-old woman presents with her son to her primary care physician for evaluation of confusion. Her son reports that she has had a progressive worsening of memory over the last year, as well as increased falling. Past medical history is significant for hypertension and type 2 diabetes mellitus, and she has not had any recent changes to medications. Memory testing reveals deficits in short-term memory and executive functioning. Physical examination reveals that when she walks, she moves slowly, takes small steps, and has a wide base. MRI of the brain is significant for ventricular enlargement out of proportion to cerebral atrophy. Which of the following additional features is most likely present in this patient? A. History of personality changes preceding memory changes. B. History of stepwise decline in cognitive functioning. C. Sensitivity to antipsychotics. D. Urinary incontinence. E. Visual hallucinations. The correct answer is D. Urinary incontinence. The patient's symptoms, clinical features, and imaging findings are consistent with normal pressure hydrocephalus, which presents with the classic triad of confusion, ataxia, and urinary incontinence. Answer choice A, history of personality changes preceding memory changes, is incorrect. This pattern is characteristic of frontotemporal dementia, which presents with brain atrophy in the frontal and temporal lobes on imaging. Answer choice B, history of stepwise decline in cognitive functioning, is incorrect. This pattern is characteristic of vascular dementia. While this patient has multiple risk factors for vascular dementia, such as advanced age, hypertension, and diabetes, onset of confusion is more likely to occur in acute bursts, rather than gradual decline. Additionally, neuroimaging typically shows signs of stroke. Answer choice C, sensitivity to antipsychotics, is incorrect. This is a common component of Lewy body dementia, which is also characterized by visual hallucinations, rapid eye movement, REM, behavior disorder, and spontaneous Parkinsonism. This patient lacks these features, and her imaging findings are more characteristic of normal pressure hydrocephalus. Answer choice E, visual hallucinations, is incorrect. Visual hallucinations are a common component of Lewy body dementia, which is also characterized by sensitivity to antipsychotics, REM behavior disorder, and spontaneous Parkinsonism. This patient lacks these features, and her imaging findings are more characteristic of normal pressure hydrocephalus. Key learning point. Normal pressure hydrocephalus presents with ventriculomegaly disproportionate to cerebral atrophy on imaging, and is characterized by the triad of confusion, ataxia, and urinary incontinence.